22nd of December 2016, if we do not have all these issues sorted out, there will be no single clinic in this country that will be functioning.
The threat issued on Monday by consulting doctors in private hospitals, and with the clock ticking towards midnight, the crisis currently plaguing public health institutions may be transferred to the private sector. Among those set down their tools are doctors from public hospitals working for private hospitals and special arrangements, and senior consultants. Private hospitals, though, also have medics on full-time employment, but not members of the KMPDU. Their numbers say to be minimal, however. In a statement to newsrooms, the Aga Khan Hospital urging that while it has contingency measures in place to respond to the increasing number of patients seeking healthcare services, provision of services may take longer than usual. Since the doctor strike began, public health facilities across the country have been forced to close their doors to the public as the stalemate between the government and the doctors continues. Solidarity forever. The negotiations once again being hosted at the Ministry of Health headquarters today after last week's attempts at the labour docket failed to yield a deal. This even as the officials of the Doctors' Union urged members to join them in court on Thursday as a sign of solidarity in the face of contempt charges against them. The officials risk a 6-month stint in prison or a fine to be determined by the court for failing to call off the strike despite the court orders issued against it. The doctors have maintained that they want the government to implement the contentious collective bargaining agreement that was signed in 2013 that seeks to harmonize doctors' salaries, granting them a 300% raise, while the government wants the doctors to negotiate a new deal, neither side willing to cede ground. Wilkis Anyabo, Citizen Live at 9.